Hello viewer, Ujambo. Welcome to this channel where I, Grace the nurse, talks about mother and child health care. Our today's lesson is on infant feeding. So the aim of the teaching today is on counseling, on exclusive breastfeeding, and the benefits of colostrum. The aim of our lesson today is to talk about exclusive breastfeeding and the benefits of colostrum. Now, since I've said we are talking about infant feeding, who is an infant? An infant is a newborn baby from 0 age to 12 months. An infant is a newborn baby from 0 age to 12 months. So a young baby from birth to 12 months of age is called an infant. When we talk about feeding of an infant, WHO and UNICEF recommends what they call exclusive breastfeeding. When we talk about feeding of an infant, we follow the guidelines of WHO and UNICEF on what they call exclusive breastfeeding. So, what is exclusive breastfeeding? Exclusive breastfeeding is when a baby receives breast milk only without any other introduction of other foods like formula, water, or anything else. So exclusive breastfeeding is when a baby receives breast milk only, no formula, no water, or anything else. This is the recommendation of the UNICEF and the WHO. So my role as a health worker is to do education to mothers immediately after birth, the importance of exclusive breastfeeding. Exclusive breastfeeding, as we have said, is giving a baby only breast milk without giving anything else. And therefore, there are some benefits which are associated with giving the baby the breast only. When we were talking about the aim of this lesson, I said we are doing counseling on exclusive breastfeeding and the benefits of colostrum. So what is colostrum? We are told that colostrum is the first milk or the first breast milk that is expressed when the baby sucks. Colostrum is the first milk that comes out of the breast when the baby sucks, immediately it is born. So initiating an exclusive breastfeeding should be done when the baby shows the signs or the cues of wanting to feed. Which are these signs? Number one, there is what they call drooling. Drooling. Mtoto anaanza kutafuta matiti. That is drooling. Then there is tangling. Tangling, mtoto anaanza kutoa ulimi. That's another sign to tell you that the baby is ready for breastfeeding. Another sign is biting of the hands. Mtoto anaanza kutafuta mkono yake kukula. It's a big mistake, and I've always told mothers in our maternity that when the baby is born, immediately the baby is dressed. And not only just dressed, it is overdressed to an extent of putting some socks they put on the hands. That is not a good habit. Because the baby uses, we are told, for you to know that the baby is ready to breastfeed, there is what they call drooling. Drooling ni mtoto anazungusha kichwa hivi, anaweza kaa pande moja akitafuta matiti, or anaanza kutoa kaulimi, ama anaanza kukula mikono. So please, when you deliver your baby, stop dressing the baby up to an extent of putting socks on the hands. I don't know what you people call them. So there is importance of putting this baby on the breast to you and to the baby. To the baby, it is food. And we are told you are not supposed to give anything else until this baby reaches 6 months. This book has got that information whereby you are told you are not supposed to give your baby anything else until the baby is 6 months. Do you have this book with you? Have you seen this diagram? Whereby from here up to here, where you are seeing the dotted line, is where the 6 months are. And therefore, this baby should not be given anything else apart from the breast milk. Okay? This is important because the first milk of the baby of the breast gives the baby all the cells that are important for the baby's protection against infection. So the colostrum, or the first breast milk, is essential, contains all the essential nutrients and the immune cells to protect the baby from infection. And therefore, this book, if you can see it closely there is a place where there is a dotted line here, which is telling you that this baby should not be given anything else apart from the breast milk. After the breast milk, for 6 months, this is where now the baby can be given something different. Okay, you can see some small bowls here, which are telling us that now the baby can be fed. But for the first 6 months, the baby should be given only the breast milk. So, what have we learned today? Short lesson on exclusive breastfeeding and the benefits of colostrum. Exclusive breastfeeding, we have said the baby should be given only breast milk without giving any other external foods. So no formulas, no water, no anything else. During our time when we were delivering babies, our mothers used to tell us to give babies either pawpaw, sijui viazi, sijui nini, but nowadays all those things have been discouraged. So kindly follow the UNICEF and the WHO regulation of feeding your baby only with breast milk without giving anything else. This one has been proved to improve the newborn's health. We have seen that the breast milk contains cells that has got immune to protect the baby against infections. So I'm just doing my role as a health worker to pass the information to you on how to take care of an infant. And we have said an infant is a baby who is 0 to 12 months of age. That is when they are celebrating their first birthday. Thank you.